Hey team, welcome back to Breathe Easy. Today's episode is our fiscal year 2026 Q2 update for the Skin Wound Champion Initiative, with a specific focus on respiratory device-associated skin integrity prevention. I'll give you a headline right up front. Overall performance remains strong, and at the same time, our data shows a clear opportunity to tighten consistency so we can reduce harm even further. Today, I'm joined by one of our Skin Wound champions, David Ivey. This episode is designed to be a quick, clear, executive-level check-in, not just for champions, but for anyone who touches respiratory devices at the bedside. The goal today isn't perfection or blame, it's transparency, learning, and making prevention feel doable and repeatable across every shift. Thank you, David, for being here.
Hey everyone, I'm David Ivey, your fellow RT, just going over some stuff with Danielle. So, a quick reminder of what this initiative is really about. The Skin and Wound Champion Initiative exists to reduce medical device-related pressure injuries, especially those associated with respiratory equipment, through education, auditing, and consistent preventive practices. What makes this work effective is that it's data-driven, patient-centered, and collaborative. Respiratory therapists, champions, leaders, we're all part of the same system, working daily to protect skin integrity while still delivering safe and effective respiratory care.
So, David, this matters so much. Respiratory devices are life-saving, but they also sit directly on fragile skin, often for long periods of time, and often on our sickest patients. That combination means risk, even when care is appropriate and prevention is attempted.
Medical device-related pressure injuries can develop quickly, even when prevention steps are documented and followed. Factors like patient acuity, immobility, edema, moisture, and prolonged device use all stack risk on top of each other. That's why this initiative emphasizes moving beyond a checklist mentality. Instead, we focus on reliable prevention, reassessing fit, reassessing skin, and learning from events so we can keep refining what actually works at bedside.
So, David, can we talk about some of the data? Because it helps us learn, not judge. So this is our year-to-date picture of Q2, right?
Here's what we're seeing. Prevention practices were documented in about 86% of audits, which tells us teams are applying prevention strategies consistently. At the same time, skin breakdown still occurred in some cases, even with prevention documented. That's what we call residual risk, and it tells us there's still room to refine how we care for certain patients and devices. Education was documented in 47% of audits, suggesting education is happening, but we're not always capturing it. The good news? 87% of audits showed no respiratory device-related skin breakdown. That remaining 13% is our opportunity space, and it's specific enough that we can target it.
So what are we actually doing with this information? David, can we talk about some of the actions?
First, we've continued ongoing auditing and bedside coaching, reinforcing prevention practices in real time. Second, education reinforcement has continued beyond the Q1 mandatory requirement, including reminders like this podcast to keep awareness fresh. Third, we're evaluating targeted equipment options for higher risk patients, such as slim fit interfaces for malnourished and elderly patients. And finally, a big structural win. The Assistant Manager of Equipment and Supplies completed the Wound Team Associate Program, giving us stronger internal expertise and support moving forward.
Let's pause for a quick reality check because operational context matters.
Team engagement and staffing have stabilized following some Q1 compliance challenges. After several departures related to audit noncompliance, we welcome Joanna Wattier on night shift and Cameron Joyner on day shift. Like every unit, we still see challenges from callouts and PTO, which can make completing 5 audits per month challenging, but auditing has continued. We've also completed 6 educational offerings focused on respiratory skin device and wound considerations, with a lunch and learn pending confirmation. Bottom line, the work continues even with real-world constraints.
Okay, this is my favorite part. Let's talk about the pressure pause.
Before you walk away from a patient with a respiratory device, pause and ask, Is anything tight enough to leave a line? Is moisture trapped underneath? Are contact points protected or cushioned? And did anything shift after turning, movement, or care? And if you offered education, even brief reinforcement, please document it. Improving education documentation beyond that 47% helps show that your care already provides and supports future prevention strategies.
So, David, where does this take us?
By the end of the fiscal year, we expect to see improved educational awareness, stronger confirmation of prevention practices through ongoing audits, increased engagement with audits and education touchpoints, and continued reduction in that remaining opportunity space. All of this aligns with organizational goals around patient safety and quality.
So thank you, David, for joining us today. Thank you to all of our respiratory care teams and Skin Wound champions for the work that you do. Much of it is unseen to protect our patients every day. Prevention, auditing, and education and learning from the data from prevalence truly make a difference. Let's keep doing the small, consistent things that prevent harm before it starts. And as always, breathe easy.